Some of the anxiety you've been attributing to your life may be coming from your blood sugar. Not all of it, not for everyone, but for a significant number of people, a meaningful portion of what they experience as physiological anxiety is a physiological event with a dietary trigger, and they've never once considered the connection because the internal experience is identical. Here's the pattern. Anxiety that arrives on a schedule, mid-morning, mid-afternoon, around 4 o'clock maybe, not connected to anything happening, it just shows up. A racing heart with no reason for it, irritability that feels disproportionate, a sense of urgency about nothing in particular, sometimes a tremor in the hands, sometimes a sudden inability to concentrate on something you were managing fine 20 minutes earlier. And then you eat something, and 20 minutes later, it lifts. Or this version, you've been told you have anxiety. Maybe you've been treated for it. And the treatment helps somewhat, but never completely, and never in a way that matches how significant the symptom feels. You've done the work. You've examined your life, your relationships, your stressors, and you keep arriving at the same conclusion. This doesn't feel proportional to anything I can identify. That mismatch is worth paying attention to. Here's the mechanism. Your brain runs almost exclusively on glucose. It has essentially no storage capacity of its own, which means blood glucose is not a metabolic preference. It's a continuous requirement, monitored with more urgency than almost anything else in the body. When blood glucose falls below the threshold the brain requires, the body does not wait. It does not send a polite signal. It releases adrenaline. Adrenaline triggers glycogenolysis, the rapid breakdown of stored glycogen into circulating glucose. It is the fastest available mechanism for restoring brain fuel, and it works. But adrenaline doesn't only mobilize glucose, it also raises the heart rate, increases respiratory rate, redirects blood flow, heightens vigilance, produces a subjective sense of threat and urgency. The adrenaline released to rescue your blood sugar is chemically identical to the adrenaline released when you are actually in danger. Your nervous system cannot distinguish between them. Your conscious mind receives the same signal either way, and then does what human minds do. It looks for a reason. This is where it becomes genuinely difficult to see. The adrenaline arrives, the body signals threat, and your mind, reasonably, intelligently, scans the environment for a cause. It finds your workload, your relationship, the email you haven't answered, the conversation you're dreading. Something plausible is always available. So the physiological event gets filed as a psychological one, and you go looking for a psychological solution to a metabolic problem. The attribution is wrong, but the reasoning behind it isn't. Your mind did exactly what it's built to do. Now consider the volume. A person with unstable glycemic control may generate 3 to 5 of these adrenal rescue events per day. Each one produces elevated adrenaline for roughly 20 to 40 minutes. That is 80 to 200 minutes of daily adrenal activation from diet alone, before a single life stressor has been accounted for. That is not a minor contributor. For some people, it is the largest single source of adrenal load in their day. So what produces this pattern? Refined carbohydrate on an empty stomach, the fast rise and faster fall, skipping breakfast and running on coffee until lunch, long gaps between meals with no protein or fat to slow absorption, meals built almost entirely from carbohydrate. And here's the part that closes the loop. Chronic adrenaline elevation itself impairs insulin sensitivity, which destabilizes glucose further, which triggers more rescue events. the dysregulation feeds itself. The physiology generates the pattern that perpetuates the physiology. When people say they're running on adrenaline, what we measure in the clinic is cortisol rhythm disruption. The adrenaline is what you feel. The cortisol curve is what it looks like under the hood. Glycemic instability is one of the most common and least recognized drivers of that adrenaline. It is also one of the most modifiable. I do want to be careful here. I am not saying anxiety is blood sugar. Anxiety has many causes: physiological, circumstantial, neurochemical, traumatic. Those are real, and for many people, they are the primary driver. What I'm saying is that glycemic instability produces a physiologically identical signal that is extremely common, and that it is almost never screened for when someone presents with anxiety. It's not the whole picture. It is a piece of the picture that gets missed with remarkable consistency. If your anxiety arrives on a schedule and resolves when you eat, that is information. Stabilizing blood glucose is not a dietary recommendation. It is a stress physiology intervention. Every rescue event you prevent is adrenaline your system doesn't have to produce and doesn't have to recover from. For someone already running low on reserve, this is not a small change. You may not be as anxious as you think you are. You may be running on fuel that keeps you running out. 2 decades of clinical practice, 5 distinct stages, each with a specific clinical picture, measurable markers, and a specific direction of treatment. What restores you below a certain threshold actively depletes you above it. The map is in the course. The link is in the description. In the description below is a free 5-day course. Day 1 alone will change how you read every morning you've ever had. Over 5 days, I'll walk you through the full mechanism, what's happening in your body, how it progresses, why conventional approaches miss it, and what genuine recovery actually requires. The link is in the description. I'll see you tomorrow. I'm Dr. Jason Trombley, DAOM, AP. This is the Adrenaline Project.